Well, welcome. My name is Doug McCullough, and this is my son, Jordan McCullough. Together, we're Doug McCullough Insurance Agency, and we're here to talk to you tonight about Medicare and Social Security. These things really go hand in hand to build the foundation of your retirement benefits, replacing your paycheck and your employment health benefits. So we want to make sure you have all the information you need to know to really understand these two important programs better.
All right. All right. I have my PowerPoint pulled up here. Let me get over to it. So my name is Jordan. As my dad said, we're going to be talking about Medicare. A couple of things I want to get out of the way before we get started is that we do not offer every plan available in your area. Any information we provide is limited to plans that we do represent. You can always contact 1-800-MEDICARE, medicare.gov, or your local state health insurance program for help with plan choices. That's a disclosure that we read all the time whenever we're talking about Medicare materials. However, this presentation specifically is only for educational purposes, so I am not going to be providing specific information about any particular plan. This is all just kind of general Medicare knowledge for you. So we are independent insurance brokers. And what that means is that we don't sell just one type of Medicare plan with one particular insurance company. We are contracted with many different insurance companies so that we can help provide you with information about a wide variety of choices. And we can also help you enroll in whatever choice that you end up making. It's just the two of us. So if you call, you're going to be talking to one of us most likely, or getting in contact with us in very short order. So when you do have questions, you really know who you're calling to ask those questions to. We also don't charge extra for our services. We are contracted with and paid by insurance, by the plans. So there's no extra cost if you enroll with us or directly with the plan. It doesn't change what you pay. So what is Medicare? Medicare is the largest U.S. government health insurance program, and it serves more than 66 million people. It is federal health insurance for U.S. citizens and legal residents, and it is individual health insurance. It is not Medicaid, it is not Social Security, and it is not a family plan. So are you eligible for Medicare? Well, you're eligible for Medicare when you are 65 years old, or you have a certain disability, and you have been a U.S. citizen or a legal resident who has lived in the U.S. for at least 5 consecutive years. What if that's not you? What if you're not 65 yet, but you're going to be losing your employer coverage, or your spouse is losing their employer coverage? We have solutions for that as well through individual marketplace, and we can help you with that. That's something that you would want to set up an appointment with us so that we can kind of go over your specific situation to see what other options there are for you until Medicare. So now you know that you are or are not eligible for Medicare, and it's time for you to enroll. You can enroll the 3 months before, the month of, and the 3 months after your 65th birthday. There's also special enrollment periods that are available throughout the year that are dependent on your specific situation, like if you were to be leaving employer coverage. So that's another thing that we can help you identify by setting up a meeting with us. When is your specific enrollment period?
3 months before you can month of your birthday.
Yep. And the 3 months after. There is also, if you've missed that 3 months after, there is also a general enrollment period every year that goes from January 1st to March 31st, where you can make enrollment decisions. Every year, there's also an open enrollment period where you can add, drop, or change Medicare coverage. That's at the end of the year. It's October 15th to December 7th. And any changes that you make in your Medicare become effective the 1st of the following year. That is OEP, it's open enrollment period, and that's a period where you can sign up for Medicare if you did not do so during your initial enrollment period. Yeah, it's an annual enrollment period. So they kind of use very similar sounding terms. So you can really, the end of the year period is for making changes to it. And you can make changes in the beginning of the year, but really that is designed for also signing up if you have not done so before. So to help you decide the best fit for you, here's an overview of Medicare options and what each one covers. So step one is getting enrolled in what is called Original Medicare. That's Part A and Part B. Together, those two things are called Original Medicare. Part A pays for hospital stays and inpatient cares, and Part B pays for doctor visits or provider care, as well as anything outpatient. If you are receiving Social Security or Railroad retirement benefits before turning 65, you will automatically be enrolled in Medicare Part A and Part B when you turn 65. If you are not receiving benefits and you want to start receiving benefits or enroll in Medicare when you turn 65, we just contact Social Security and get your enrollment process started, and we can also help you with that. So once you have your Original Medicare Part A and Part B together, there's two different paths that we really want you to start thinking about going down, and kind of two primary methods that people typically go about for participating in Medicare. So option one is Original Medicare and a Medicare supplement. A Medicare supplement is private insurance that you would pay a monthly premium for, and in exchange, the supplement pays any or most of the cost that a beneficiary would incur. So it helps insure against costs that aren't covered by Original Medicare. When I was talking about Medicare Part A and Part B, you might have noticed I did not say it covered prescription drug coverage. So Part D is a separate plan that you can get along with Medicare supplement, a Medicare supplement plan, to help provide a more round and complete picture for your health insurance. So that's option one. Option two is what is called Medicare Advantage, or Part C. That is when a private insurance company becomes the primary payer for your health care. So the federal government is no longer paying your health bills. They are paying a private insurance company to help administer those healthcare costs. And you pay under Medicare Advantage usually most commonly by paying co-pays and co-insurance and deductibles when you receive care. So if you think of option one as kind of paying premiums in advance to help pay for your care, and option two, Medicare Part C, as paying as you go, and there's some other advantages and disadvantages to that as well. So what does it cost? Most people will receive Medicare Part A based on their working years, 10 years or more for either you or your spouse, at $0 per month. Medicare Part B has a standard premium of $185 per month. If you're a high earner, that premium can go up. We're going to start going into the cost with each of these, and that's where the supplement would come in to help pay for those. Yes, Cindy? Yeah. High earner is, what's the?
For a single person, over 106,000, and for a married couple, it would be, I believe, 206,000 per year. And they go back 2 years, and they look at your previous earnings record to determine what it would be for the coming year.
Yeah, so it can change. You could have a higher premium 1 year, and then as you say, if you were a higher earner when you were working, but your income is lower once you stop working, that increased premium can change or go back to the standard premium later. So some of the costs, $1,676 deductible for Part A. So that is per a hospitalization. If you go into the hospital, that is how much it would cost you per benefit period. And we're going to kind of break down what a benefit period is and some of those costs a little bit more in a second here. Part B has a deductible of $257 per year. So you are responsible for paying that first $257. And once that is met, then the Medicare starts paying their portion, which for most services is 80% Medicare pays, and you would be responsible for 20%. Well, 20% of a hospital stay of expensive treatment, tests, procedures can be a pretty high number. So that's why we'll talk about supplements and how that helps control some of those costs. We're going to get into that exactly or a little bit more. Yep. So it's 20% is what a person pays, is what they're responsible for. And we'll go over what services those cover. So the first thing that I wanted to talk about was the Part A deductible that I mentioned of $1,676.
While we're on that, is that per event period or per occurrence?
Right. So it is per benefit period. So what is a benefit period? So let's look at this example. Day 1, you go into the hospital. Day 10, you are discharged. You now have 60 days from the day that you are discharged to count as a benefit period. So if you go back into the hospital on day 44, that is the same benefit period. You do not pay the deductible again. It's only 60 days from discharge. So you can see where you could have multiple hospitalizations in a year. And you'd have to pay that deductible for each benefit period. If you are in the hospital for more than 60 days, then every day up to day 90 is an extra $419 per day. A hospital stay of 60 days would be pretty long, but beyond 90 days, then it goes up to $838, and you have a lifetime reserve days of 60. Right? So those numbers are, you obviously need, most people look at that and say, I need to do something to control that cost because that is way too high. Skilled nursing care, $0 for the first 20 days, $209.50 for every day after that. So what does Part A cover? It is inpatient hospital care, skilled nursing care, hospice care, and some home health care. So while you are in the hospital, you can have your Part A meter running and Part B. Because you can receive care from a doctor while you're in a hospital. You can have tests while you're in a hospital. You can undergo procedures, things like that. So let's break down what some of the cost B, or Part B costs are rather. So this is the annual deductible of $257, and the beneficiaries pay 20% once the deductible is met. And here is kind of what we were talking about for what is the beneficiaries. What are some of those services? Ambulance services, chiropractor, doctor office visits, surgical services. Part B, drugs. Those are drugs that are administered like in a hospital setting or by a medical professional. Emergency room services, diagnostic tests and procedures, speech therapy, occupational therapy, physical therapy, group, individual, chemotherapy, radiation, dialysis. 20% can really add up. And as I said, so it does not cover, so Medicare does cover a lot of routine or preventative care, and they pay 100% of that. So prescription drugs are not covered under original Medicare. Hearing aids, dental, vision, dentures, cosmetic surgery, all of that is not paid by Medicare. So this is where a Medicare supplement would come in. It's something that you could pay a premium for, and that it would help control those costs of hospital stays and doctor care. some of the benefits of it is that there is no prior authorization if you have a Medicare supplement. There is no insurance company doctor looking over your doctor's shoulder to say yes or no for care. There are some services that are covered by original Medicare that are subject to prior authorization, but it is not as extensive as a prior authorization process or possibilities as with Medicare Advantage. There is no networks, so any doctor who takes original Medicare, which is pretty much every doctor, is going to also work and take your supplement. During your initial enrollment period, or there are also guarantee issue periods where you can go and sign up and get a Medicare supplement without having to answer health questions. They are guaranteed issue, you're guaranteed to get the best rate, they're guaranteed renewable year after year. So there's something that when you are first becoming eligible for Medicare, it is a very important that you are considering this option initially, because it is when you get to come into it without having to answer health questions. Even if you're healthy, you might not think you need it, but if you wait until you're sick to try to enroll in it, then it can become, it's harder to go back, and then you're subject to health questions and to really to be able to consider that as an option, because the affordability of it really, it changes that calculation. So some advantages: it's accepted by any medical provider that takes Medicare, very limited use of prior authorizations, and it can help pay for most, if not all, of your healthcare costs. There is the deductible of $257 that you still have to pay. There could be excess charges. Those are very rare, but it is a possibility. Disadvantages: dental, hearing, and vision is something that you would have to get separately, and you might have heard a lot of extras with Medicare Advantage that Medicare supplements don't have as much of. So it's just not as many trinkets, more of the nuts and bolts of healthcare. So I think that is my last slide. Oh, really quick about some prescription drug coverage information. A standalone prescription drug plan is something that you can add on along with a Medicare supplement. A good thing about prescription drug plans is that they have a $2,000 maximum out of pocket for any prescription that is covered, meaning that the most that you would pay in any given year for the totality of your prescriptions is $2,000. And there's also, it's not just what you pay, there's also some credit that you get from what the insurance company pays and what drug manufacturer pays. So it could be a little bit less than $2,000, but that is, the cap used to be much higher. So this has come down significantly starting in 2025. Part D coverage is also available through Medicare Advantage plans, and we'll get into that in a moment here. Yeah, Cindy?
Jordan, bear with me.
Yeah.
This is-
Uh-huh.
Just talked about Medicare supplement, Medicare,
Yep.
and all the advantages or
Yes.
disadvantage. Now you jump to Part D, and you're talking about the Medicare Advantage plan, which is different than Medicare supplement, correct?
You got it. Yeah. So this is a great thing to help delineate for you in your
So if I'm
mind.
interested in supplement, Medicare,
Yep.
what are my Part D options? Yeah.
So those are standalone prescription drug plans. So a Part D plan can be a standalone plan. And then, so that is one option if you're considering a Medicare supplement. If you go the Medicare Advantage route, most people are selecting a Medicare Advantage plan that has a Part D component built into it. So it's not a separate plan, it's kind of built in with Medicare Advantage. That's a great distinction to make, Cindy.
Insurance can-
No, so if a supplement is a separate plan and prescription drug Part D is a separate plan. So that let's distinguish two separate things. So Medicare supplement and prescription drug plan is a option. And then Medicare Advantage can have prescription drug coverage built into it.
So if we went back to like one of your previous slides, that would have been the one that was way over on the right.
Yes.
Yeah. So we're going to review this a lot. We
Yeah.
want to keep, and we want to try to, let's compress some of the questions towards the end, because I think that when Jordan goes through everything, a lot of it'll pop, because he's going to go ahead and repeat things over. And we have an audience at home too. When we ask questions, they can't hear.
Oh, yeah.
So then
Sure,
I can
some of
take your
those.
questions and I'll read them so that our audience can hear them. And then we'll make sure all the questions get answered.
Okay.
Thank you.
So we did talk about high earners. There's also, if you are low income, some help that is available through low income subsidies that can help pay for prescription drug costs. It can help pay for deductibles, co-pays, and also for premiums as well. The resource limits are up here, but it's 1,978 for an individual, 2,665 for a couple. That's a monthly income limit. And then resources of less than 17,600 for a single and 35,130 for a couple. So that wraps up the Medicare supplement part.
So,
Should we do some,
yeah.
I mean, keep going, or should you want me to stop for questions?
Well, I think once you're done, or,
Get to then.
yeah,
If anyone has a Medicare supplement question now, I'll take that as well. Or I'll just dive into Medicare Advantage. So Medicare Advantage, now one way of thinking about it is dividing it into two categories for Medicare Advantage plans as HMO or PPO. HMO is a network of providers that you would need to stay within in order to get your health care. A PPO has a network of providers. However, it allows you to go outside of that network. However, you typically are going to pay a higher cost. So the HMO plans, if you have a pretty tailored list of doctors that you want to see, the plans can sometimes have richer benefits compared to its PPO counterparts, because the networks are a little bit smaller. Some advantages of Medicare Advantage. Most plans are no premium, other than what you're paying for your Part B premium. They have extra benefits like dental, vision, and hearing, maybe an over-the-counter card that you can use to buy some over-the-counter items. It covers everything original Medicare covers. However, those services are also subject to prior authorization, meaning that you can have care denied also. They have, a lot of plans have Part D coverage built into them. There's annual out-of-pocket maximums for Medicare Advantage. So even though when you go for those certain tests and procedures or chemotherapy where you would be responsible for 20% of the cost, there is a maximum out-of-pocket that you would pay for the year. A lot of plans, it's like between $6,000 to $7,000, maybe $5,000 that you would pay. So it helps put a ceiling on what the most is that you would have to pay for a Medicare covered service. The prior authorizations are, statistically, 13% of the time, according to a recent government report. However, when you're the one encountering a prior authorization denial, the statistics don't really matter too much, right? When you're the one that needs a post-acute care and you're being told, no, it's time to go home from the skilled nursing facility, that becomes the stick, a hard part to really handle. And people can have Medicare Advantage regret sometimes because of that. The plans change every year, so it's important to be reviewing the policies with us. We set up time every year during that annual enrollment period to go over what the coverages are. And you can't get a supplement to pay your cost that you incur under a Medicare Advantage plan. It's one or the other. So you're really deciding original Medicare and a supplement or Medicare Advantage. This is a chart about prior authorizations. So for the last year that data was available, there were 50 million prior authorizations under Medicare Advantage. As compared to original Medicare, it was about 330,000. So the likelihood of running into a prior authorization under Medicare Advantage is significantly higher. And then for the last year that there was data, it was just over, it was 6.4% of the time that that the care is denied. Only 12% of those denials are appealed, really because you need your doctor to help appeal it and argue with the insurance company why you need that care. If your doctor does it, the likelihood of that denial being overturned is like 80%, but it's time consuming and a small percentage of the denials are actually appealed. Any delay in care is really, it interrupts treatment plans and it can be very troublesome. Another category of Medicare Advantage plans are, so there's what are called dual special needs plans. Those are for people that are on Medicaid and Medicare. And the Medicaid will can help pay for some of your costs that you would have under a Medicare Advantage plan. So if you are in that category, that is something that we would want to set up an appointment to talk with you about. There's also special plans for people that have chronic illnesses like diabetes or certain heart conditions. And the plans in that category have kind of benefits that are tailored for those diseases. They skew it a little bit to help people in those categories. There's also special plans for people that are institutionalized. I'll touch on the Inflation Reduction Act really quick, specifically the changes for 2025. The biggest one, maybe I think, is the $2,000 maximum out of pocket on the prescription drug coverage. Has anyone ever heard of the donut hole for your prescription drugs? For people that were on Medicare and going to get their prescriptions filled, and then all of a sudden at usually around like a midpoint in the year, they would go to get their prescription and it would be significantly higher than what it had been the last month when they went to get it. And that was called the donut hole. Well, when people hit the donut hole, eventually, some people would say, well, I can't. And then they would leave without their prescriptions. So this $2,000 maximum out of pocket, it's significantly lower. And once you hit that, you can continue to get your prescriptions. However, you don't have to pay for them anymore. So that it really makes prescriptions more accessible to people throughout the year. There is a Medicare prescription payment plan program. It's pretty complicated. And if you end up, but it can help people that have high prescription drug costs. So if you think that's a decision that you really would want to have some consultation either from us or from the insurance plan before enrolling in it to see how it would shift your drug cost. So this is my last slide. This is the key takeaways that I want for you, is for you to kind of understand and start thinking about Medicare and as two different paths, either original Medicare with the supplement and or prescription drug coverage, or option two, a Medicare Advantage Part C. And we have clients that have both, and we help kind of go over all those options and explain what those plans are so that when you're enrolling in them, you can weigh different factors.
So just any questions for the group?
Nin?
Okay, on your Medicaid, Medicare Part C, who's the primary? Is that, when you're looking at the supplement, is the primary now Medicare, or is that your supplement?
Okay, the question is under Medicare Part C, this for the people at home, is what's the primary insurance?
So if you are on Medicare Advantage, the payer for your doctor, for your healthcare, for your bills is the insurance company. That
So
is,
it's your supplement.
well, so supplement and Medicare Advantage, we're going to think of those as two separate things. So under Medicare Advantage, the primary payer, the only payer is your insurance company. And I say they're the only payer, however, you pay as well. You pay co-pays and co-insurance and sometimes deductibles under Medicare Advantage.
And one important way to think about it, if you have Medicare Advantage, you cannot have a Medicare supplement. So Medicare Advantage is your primary insurance. Under original Medicare, you have two payers. Original Medicare, the government is your primary insurance if you have original Medicare. And then the supplement is your secondary payer. So that's probably another way to slice it to.
I went over my time, so I'm queuing up his slides. But if there are any other questions, we're not rushing off to that, but I'm helping him with the technology.
Yes, you're doing a great job with the technology, Jordan.
All right.
So one last question. If we have specialty, we just should book appointments with you guys.
Absolutely. I think, a consultation, and we go through a lot of the same information when we have we call it a new client Medicare review. Again, that's more tailored to each person's individual situation, not plans yet, more like the advantages and disadvantages in understanding your options and enrollment timing and what your next steps are. So we do a lot with people when they're just kind of making that transition to help them make a successful transition from their employment coverage, maybe even to bridge in between into like a individual health plan. Sometimes one spouse is ready for Medicare and the other spouse is not quite old enough. So we'll go ahead and take all those factors into consideration and help you tailor this information to exactly what you need to know and develop a step-by-step plan of implementing your transition from, whatever you're doing now to Medicare. And then the nice thing about it is we do an annual review for our clients just to make sure that their plan's on track as things change. So a lot of times it makes all the difference. We identify things that are little important nuances that change on a yearly basis to make sure that you're getting the access and the care that you need.
All right.
Okay. Well, so on to Social Security. So I want to talk a little bit about Social Security and help you understand your benefits and understand how to optimize your Social Security benefits. A lot of you might have been around like me in the early 80s. I don't know if you remember the talk about Social Security. Is Social Security is going to run out of money? It's going to run out of money. I mean, they were right up to the line of running out of money in 1983, and they passed a big bill that extended the solvency of Social Security for 50 years. Now it's 50 years later. What are they talking about? Oh, Social Security's running out of money again. So, this is really, one of the things that I want to just kind of get out there is the politicians that control all of this, they answer to us, okay? And when the heat gets turned up enough to solve the problem, they'll pull a rabbit out of the hat. Until then, we'll see. So I do have a couple of articles that I'm going to share at the end. They have really in-depth information about plans to ensure the solvency of Social Security, and also information about what happened back in the 80s. I had to kind of pull it up and refresh my memory about it. And I'm going, yeah, I remember that now. Okay, so what are we going to learn about today? The importance of Social Security and how it mitigates longevity risk for seniors. We're going to learn about Social Security basics. the rules, the benefits that you can get. We're going to learn about client claiming strategies. What are the important things to consider to know when to claim your Social Security? And also, we're going to give you some case examples to help you understand how to optimize your Social Security benefits. So I'm, in addition to being an agent with Jordan for helping people with their Medicare, I'm a registered Social Security analyst. I have specialized training and tools to help people understand their claiming strategies and options under Social Security. But I'm not a financial advisor. I don't sell any financial products. I really got involved in this because so many of my clients that are approaching Medicare had questions about Social Security too, and I just didn't want to seem like a dummy. So I got some more education about it so I can be more helpful to my clients. So the importance of mitigating risk for seniors, retirees. Why do people need help? Well, it's so complicated. There's 11,200 people filing for retirement every single day. 96% of the people that claim their Social Security benefits don't optimize their benefits over their lifetime. And what do I mean by optimize? Make sure they get the most money over their lifetime. So this, for a married couple, it can be over $100,000 over your lifetime by not optimizing your claiming strategy. So this is an important piece. The Social Security piece is an important piece to your retirement income and making your retirement work, along with a budget, along with whatever you work on with your financial advisors and investments and things like that. Social Security can be like most of it for a lot of people. We have lots of clients that they're just drawing Social Security, and it's very, very important to make sure that you've taken all this stuff into consideration. So 2,728 rules. Wow. There's thousands of different claiming options. And the Social Security Administration is prohibited from giving personal claiming advice. They don't want to be liable. There's not really a lot of reliable resources, and that's why I wanted to get involved in helping people with this. This is a page from a report that I prepare for people that want to get some insight about their Social Security claiming options. So like this represents two people and the proposed years that they retire for the spouse Alice and the spouse Peter, going along long ways. So the one in orange, that is actually based on their projected lifespans. That's the one that would be the optimal or maximum amount of benefit for them over their lifetime. Now, Social Security is more than just retirement benefits. It has special rules for people that are married and divorced to make sure that their benefit keeps track with their needs during retirement. There's special benefits for widows, children, the disabled, and there's special strategies that we can help the self-employed with to minimize their payroll tax. So it's more than just a retirement program. It's a guaranteed lifetime benefit that has a cost of living allowance. So that cost of living allowance is really an important part of helping you keep pace with inflation. Again, for many, this is the cornerstone of their retirement. A majority of their retirement income is tied up in their Social Security check. So it's a really important part of the planning. So we're not, again, not financial advisors, but we work in coordination with your financial advisors. They're some of our closest allies in helping people make a transition from working into retirement. Many of our clients come to us by referral from financial advisors and accountants and people like that. But the biggest amount of our clients come from personal referrals from our current clients. So we take a real focused approach on trying to answer all of people's questions and to be a valuable resource to our clients, because it's more productive for us to spend time with folks sorting this stuff out than to pester people on the phone like some of the marketing organizations do. So we really kind of have an old-fashioned approach in how we get our new clients, and we love helping people understand all these programs. So questions, we love them. So here's some of the Social Security rules and basics, okay? So full retirement age. Now, I don't know if you remember back, let's take us back to 1983. The full retirement age was 65 years old. But the Social Security Trust Fund had a problem. People were living longer than they were back in the 60s and 50s, okay? And the trust fund was running out of money. So they increased the retirement age to 67, and they phased it in over a few years. Again, when this law was passed, I didn't even think I was going to live to 65. I was like, 22 years old. I wasn't even thinking about 65 or 67, no big deal. But gradually, somebody born in 1960, their full retirement age is 67 for them to get their full benefit. So the full retirement age currently is based on your birth year. And that's when you collect the primary insurance amount. And that's jargon, that's Social Security jargon for the full unreduced benefit. You're no longer subject to an earnings test at your full retirement age. And retroactive benefits can be paid back 6 months after you've reached full retirement age. So qualifying for benefits. We talked a little bit about qualifying for Part A of Medicare. It's based on these 40 credits or quarters of coverage for Social Security. How do you earn a quarter of credit? $1,810 in earnings in a calendar year makes you eligible to receive 1 credit. So most workers are going to get 4 credits per year, and after a period of 10 years, they're going to be vested in the Social Security system, that they're going to be able to get a Social Security benefit. Now, it's funded by employee and employer FICA payroll contributions. Self-employed people pay what's called self-employment tax. This is goes to the same place. The maximum taxable earnings for the Social Security system currently is $176,100. And they average your earnings record and come up with an indexed adjustment for any of your earnings that were earned before you were 60 years old. So I remember, wages were pretty low back in those 80s. For me, they seemed really low. But they're indexed up so that they can calculate a more fair amount based on the cost of money or the value of money today. So to calculate the primary insurance amount, they take the 35 highest years of indexed earnings. That's, in this case, this is a pretty high earner here, $3.15 million of earnings. And they calculate this average indexed monthly earnings by dividing by 420 months. That'd be 35 years. Giving you a average indexed monthly earnings of $7,500 a month. Now, they apply these bend point calculations that are determined every year in the budget process from Congress, and they develop these bend point calculations that help them calculate the primary insurance amount. So we're not gonna go too deep into math class. My wife teaches a little math class so I'm gonna bring her up. No. So in order to make it fair, the first bend point, so that people with the lowest incomes get the biggest portion of their earnings in Social Security. Let's face it, if their average monthly earnings were only $1,300 a month, that's pretty tight. They don't have a lot of wiggle room, to make things work. So the first $1,226, the multiplier is 90%. The next bend point is 32%. And then after you hit that top bend point, it's 15%. So people with higher earnings are going to replace a lower amount of their income with Social Security. But everyone is going to be rewarded with a greater, the more they make, the more they're going to get in Social Security. Uh-oh, my clicker.
Is it not going down?
I just want to make sure I'm on the right slide. Okay, retirement reductions and credits. So we calculated this primary insurance amount for the full retirement age, 67, you get 100% of your full retirement age. You get that entire primary insurance amount of $3,092. What if you claim at age 62? At age 62, you get a 30% reduction, or you get 70% of your primary insurance amount. Or what if you wait until age 70? Age 70, you earn delayed retirement credits at a rate of 8% a year for waiting to claim your benefit. So on the same primary insurance amount, you could get as low as $2,164 or as high as $3,834, depending on how long you wait. Now, this is part of the analysis that I do, takes into consideration things like your expected mortality, the earnings record of you and your spouse, to help calculate a mix of options so you can figure out what the right claiming time is for you based on what you've got going on in your life. Spousal benefits. Now, spousal benefits are based on up to 50% of your spouse's primary insurance amount. They max out at full retirement age, so there's no delayed retirement credits for waiting past full retirement age if you're going to collect based on your spouse's earnings. You're eligible after being married for 1 year. Your other spouse must be collecting retirement benefits. Now, if you're divorced, you're also eligible to collect a spousal benefit after 10 years of marriage. And you're independently entitled after 2 years. That means that in a case where someone's divorced, it doesn't matter if that person is collecting or not. So you're independently entitled. So it doesn't take anything away from that other person's benefit. Now, survivor benefits. For survivor benefits, that is, if you're two married people, one person passes away, they have a different way that you can claim. You can claim all the way down to age 60 with a reduction, okay? At age 67, you're entitled to your spouse's full benefit if they pass away. And you also are entitled to their delayed retirement credits. So if the person worked beyond age 67, like my grandpa worked to age 70, my grandma got his delayed retirement credits. So her income was based on him working to age 70. So there's a widow's limit of 82.5% of their primary insurance amount. So that's kind of a restriction that's in there. But this is an important component that goes into the Social Security analysis. There's actually on the table in the back of the room, and this is also on our website, there's a questionnaire that has all the inputs that we gather. If you want to get a Social Security analysis, you're welcome to, take the form, fill it out. It requires a couple things. It requires a couple things, to give a good educated guess at what you think your life expectancy is. There's a website called Living to 100, okay? You go to that and you plug in you answer a few questions, you answer a questionnaire, and it tells you how long you might live, okay? Not spooky at all, not spooky at all. So I encourage people to do that. And then also I encourage people to go to ssa.gov and get a Social Security online account so that you can download your earnings report in an HTML file, okay? And if anyone needs any help with that, I have some screenshots I can email to you to help guide you. But this is a couple steps in our process to help people develop this report. Now, there's online information also from Social Security when you go up to ssa.gov, where you can get a little bit better handle on your individual amounts that you're going to get on Social Security. The report that I do is just a little bit more detailed, helps you crunch some better numbers with a little better information. Dependent benefits. So what are dependent benefits? Dependent benefits are for minor children, collecting, for parents that are collecting and have a minor child, or deceased, they would get a benefit for their dependents. 50% of the primary insurance amount while the parent is alive, 75% of the primary insurance amount of the parent if the parent is deceased. It's subject to a family maximum. So, if you might have multiple children, they can only have an aggregate benefit to a certain level that's determined each year. And all of these benefits, again, anything that you get in Social Security benefits prior to your full retirement age is subject to an earnings test. And we're going to talk a little bit more about the earnings test because this is the number one way that people get into a situation where they owe Social Security money. And if you ever heard of anyone that owed Social Security money, it's not good. So eligible dependents for the dependent benefit, minor children under age 18, age 19 if you're still in high school. Disabled adult children if you're disabled prior to age 22. And there's also a child in care spousal benefit for parents taking care of children under age 16 and for disabled adult children. So the cost of living benefits, that increases your monthly benefit amount through retirement. And usually they come out with a cost of living adjustment in December, and it affects, it's effective in January for your first check of the new year. Now, if you're not collecting benefits, the cost of living adjustment still affects you. After age 62, it adjusts your primary insurance amount based on the cost of living allowance so you don't lose ground. So here's some recent numbers, between 1% to 2% from 19 to 2021, the COVID years, 5.9, 8.7% from the COVID rebound inflation. And then now it's back to in the 2.5% range right now for the cost of living. So let's get into some of the different things to consider when you're claiming. Your maximum life expectancy is a really big deal. It's an important factor in when you're going to claim. Think of it this way, at age 65, the likelihood of you living to age 80, if you're a man, is 62%, a woman, 72%. But it climbs to 89% that one of you is going to live to age 80. And it's kind of shocking, to age 90, almost half of a married couple, half of married couples, one of those spouses has almost a 50% likelihood of living to 90. It starts to fall off towards 100, but they're saying that advancements in medical science could continue to increase life expectancies. So it's important to have benefits that are going to keep pace with inflation and help you through retirement. So women are affected more by these Social Security choices than men. Why? Because they last a little bit longer. Longer life expectancy. Sometimes they've taken time off for raising children. They sometimes marry older men. Bottom line is they're likely to be the survivor of the relationship. So there's a number of things that go into the strategy, like dual entitlement. In other words, the choice of claiming off of your benefit or your spouse's, and that survivor benefit that really takes some planning to consider before you choose when to claim. So dual entitlement means that you have a choice between claiming off of your record or your spouse's record. That's dual entitlement. So what they do is they have a spousal top off. Let's say your benefit is, this example here is Annie with a primary insurance amount of $1,000 and Andrew with a primary insurance amount of $3,000. So Annie's amount at full retirement age would be $1,500. That would be her max. But $500 of it's coming from the spousal roundup or top off, okay? And $1,000 of it's coming from her own earnings record. So it used to be they had different claiming strategies for this, and they streamlined this so that when you file your Social Security claim, you're filing for all the benefits you're entitled to. What was that?
I'm trying to get a question.
Earnings test. Age 62 to full retirement age. That's the spot where you might have the earnings test, and it might impact the amount of benefit that you get. So between age 62 and your full retirement age, $1 is reduced from your Social Security benefit for each $2 earned in excess of $23,400. So this is like the number one way that people wind up owing the Social Security Administration money, is because they didn't understand these rules and they earned a little bit extra money. They didn't report it properly. They didn't get it captured. And then they have the Social Security going back to them for benefits that they shouldn't have collected. So this is something you want to be very, very careful about. The year of your full retirement age, and this is when they break down the income month by month, okay? So my birthday's in October. October 1st, I can go ahead and collect, when I turn 67, I can collect my full benefit, no matter how much I make. But that's when they start breaking your income down month by month so that you don't go over. The threshold is $62,160 for the year you turn your full retirement age. Now, there's no limits after that. You can earn as much as you want and collect your Social Security check. You'll pay taxes, but you definitely have to be aware of overpayments. What kind of income counts? Employment income, net income from self-employment, those are earned income, okay? What doesn't count? Pension payments, annuity payments, IRA, dividends, rent income, none of those things count. So you can earn as much as you want with that without interfering with the earnings test. Overpayments, when a beneficiary receives more money a month than they should have been paid, usually it happens because they're unaware of the limitation, especially for young widows or other dependent benefits. Returning to work after previously retiring is a trigger. Misunderstanding the first year rule and the monthly limits is another problem. So other things like Social Security disability, that can be a trigger for this. Conviction for a criminal offense, those are all things that can trigger an overpayment of Social Security benefits. And, there are payment methods that you can request, but they're making those things stricter to where they want to get all the money like right now. So it's something not to play with. Options if you're collecting, you can withdraw an application during a 12-month window and repay all the benefits and just keep accruing additional delayed retirement credits, or ensure that you're going to get a bigger benefit down the road. There's voluntary suspension if you're full retirement or older. You can go back to accruing these delayed retirement credits and increasing your benefit. Now, here's one of the things that's repealed January of 2025. These are two provisions that actually extend the life of Social Security. So I want to talk to you about a couple things, and I'll give you some resources about it as well. But the windfall elimination provision and the government pension offset were eliminated last year. And this affects people that that have some earnings that were covered under Social Security and some that weren't. And it's really fair, but at the same time, it's part of what saved Social Security 50 years ago, is this unfair practice. So this correction is great because it's helping people that weren't getting the full benefit that they paid into for Social Security. So that's a fantastic thing. But where's the money to replace this? They didn't think that far, okay? I mean, I'm glad that they made it fair for these people, but what about for all of us that are relying on Social Security to be there? So I really do urge you to write your congressperson, write your senator, to say, hey, what about the Social Security stuff? It's kind of important to me. Maybe they'll listen. So optimizing Social Security benefits. Here's some examples. A couple with a primary insurance amount difference. Paul and Alice. Paul, age 62, full retirement age 67. They both have a life expectancy of 85. Paul's primary insurance amount, $3,000. Alice's, $1,000. Paul claims retirement benefits at 62 for a benefit of $2,100. Alice at 62 for $975. A total monthly benefit at age 62 of $3,075. Now let's say both of them claim at full retirement age 67. Paul gets $3,000, Alice $1,500, almost a 50% increase, $4,500 versus $3,075. So a maximized strategy is Paul claiming at 70, Alice claiming at 70 for a monthly benefit of $5,220 combined. Another example, a couple with an age difference. John, 62, Lisa, 57. They both have fairly close primary insurance amounts. The maximum amount that they could collect if they both waited to age 70 would be $8,010. But that's not going to be the optimal amount, because the likelihood is John's going to leave this world before Lisa. They're going to be better off for John to claim at age 70 and Lisa to claim at some earlier age. Again, this is why that living to 100 and trying to get a handle on what the mortality expectation is can help you, find that sweet spot, the best number for you. So this is one of the pages from the reports from their Social Security analysis. John and Lisa's heat map. So this has Lisa claiming at age 65 and John at age 70, maximizing their lifetime Social Security earnings at almost $1.3 million. So these are QR codes for a couple of reports that I found that have some very good information about how Social Security got revitalized with the legislation from 1983 and what it took and what kind of compromises went into it. It's a congressional report, basically a research report that kind of lays out everything that happened to fix Social Security for 50 years. Again, it seems like it needs another 50-year reboot. So I've got this Brookings Institute blueprint for Social Security. It's a bipartisan solution of compromise because let's face it, we live in a pretty not compromising political environment right now. This Social Security thing is going to require some compromising. So this is a real good blueprint to help people understand what kind of things are going to be important to make Social Security viable, not only for us, but for our children that are paying into it. So I definitely invite you to snap the QR code or just reach out to me. I can send you some of these resources to help you just understand it better.